I'm arguing against the proposition that the U.S. should adopt the Canadian-style single-payer healthcare system. The affirmative claims the present healthcare system in the United States is too expensive, but U.S. healthcare costs are not unreasonable compared to Canada and Britain because Americans demand the best medical technology and advancements available. According to David Gatzer of the City Journal, the picture is not quite as clear as suggested because the U.S. is so much wealthier than other countries. It is not unreasonable for it to spend more on healthcare. Take America's high spending on research and development. MD Anderson in Texas, which is a prominent cancer center, it spends more on research than the whole entirety of Canada does. Additionally, U.S. patients have greater access to advanced medical technologies than Canadians. A statistic done by the Fraser Institute in 2000 showed that we have practically twice as many open heart surgery centers, CT scanning centers, and installed MRI units. Also, due to a lack of medical technology, Canadians must enter long wait listings in comparison to Americans. James Froge of the Heritage Foundation states Canada per capita has as many MRI scanners as Colombia and Mexico. He then goes on to tell a story about a London man who was expected to wait 7 months for an MRI, but his dog could get one in just a couple of weeks. The affirmative also claims that the Canadian-style single-payer healthcare system is more cost-effective. I'd like to point out the fact that overconsumption by patients and overtreatment by physicians suggest that there's not good value for money. Medical Dr. Robert J. Kehat, the president of the Association of American Physicians and Surgeons, says that when most people enter the single-payer system, they believe someone else personified as the government is picking up the bill. As a result, people feel insulated from the cost of care and therefore tend to overconsume, driving healthcare spending much higher than it would be if patients insisted on value for money. The irony here is that the process that makes healthcare affordable for the vast majority, the third party paying the bill, is the primary factor behind making the healthcare system unaffordable. Healthcare is accessible from a cost perspective, but in actual practice, it isn't due to rationing via wait listings. Single-payer systems are confronted with dirty hospitals, long wait listings, and substandard treatment. Canadian newspapers are now filled with stories of people frustrated by long delays for care. Titles such as "Vow broken on cancer wait times," "Most hospitals across Canada fail to meet Ottawa's 4-week guideline for radiation," "Patients wait as PET scans used in animal experiments," and lastly, "Back patients waiting years for treatment." Government researchers have provided the best data for doctor shortage, noting, for example, that more than 1.5 million Ontarians can't find family physicians. Health officials in Nova Scotia community actually resorted to a lottery to determine who'd get a doctor's appointment. The affirmative also states Canadians enjoy a higher life expectancy. Yes, Americans lag behind other countries in crude health outcomes, but such outcomes reflect a mosaic of factors including diet, lifestyle, drug use, and cultural values. Healthcare is just one factor in health. Healthcare includes life expectancy, of course, but a life can end of murder, a fall, or a car accident. Such factors aren't academic. Homicide rates, and also homicide rates in the United States are much higher than in other countries, 8 times higher in France, for instance. In the business of health, Robert Oshfeld and John Schneider factored out intentional and unintentional injuries from life expectancy statistics and find that Americans who don't die in car crashes or homicide outlive in any other Western country. And if we measure a health system by how well it serves its sick citizens, American medicine excels. 5-year cancer survival rates bear this out. For leukemia, the American survival rate is about 50%, the European rate is 35%. For esophageal carcinoma, 12% in the United States, 6% in Europe, and the survival rate for prostate cancer is 81% here, 61% in France, and down to 44% in England, a striking variation. The affirmative also says no one in Canada is denied of a reasonable level of care. Sure, you can get health care, but like I said, you're going to have to wait for a hell of a long time for it. That said, American health care is expensive, and Americans aren't always going to get a good deal. But the single-payer health care would push the United States further down the path to a government-run system and make things much, much worse. True government bureaucrats would be able to cut costs, but only by shrinking access to health care as in Canada and engendering a Canadian-style nightmare of overflowing emergency room and year-long waits for treatment. America is right to seek a model for delivering good health care at good prices, but we should be looking not to Canada, but close to home. In the other 4/5 or so of our economy, from telecommunications to retail, deregulation and market competition have driven prices down and quality and productivity up. Healthcare is long overdue for the same prescription. Overall, what I'm trying to say is less government involvement in medicine would improve the U.S. healthcare system. Furthermore, the costs of medical programs are always overestimates. Congressman Ron Paul states that cost is a big deal. Every medical program ever introduced into this country, we claim it will cost a certain amount. It will cost 2 or 3 times as much. So if they say it will cost us $1 trillion, it will probably cost us $2 or $3 trillion. Thank you.